At Cigna, we do have a care coordination model with the patient-centered medical home in place currently. We do incentivize providers for their adherence to NCCN guidelines. And that is something that we continue to look at and see how we can broaden the scope of it. We're also looking to see implementation of pathways in the future to see if that would add value as well, and how to incentivize them. Ideally, in lung cancer, for example, it would be great if you can incentivize providers where if they have a patient who has adenocarcinoma and they're running the mutation studies and treating them appropriately based on the mutation studies. Let's say if they have the PD-1 status, the greater than 50% in first line, if they offer them Keytruda. So the best case scenario would be to be able to benchmark all of this and understand which providers are following the guidelines and incentivize them. At this point, we're not there yet, but we are continuing to look at different ways of incentivizing providers and to encourage quality care to improve outcomes. We have not isolated lung cancer in and of itself. It is one of the top 3 cancers in a lot of our populations. Overall, it's either breast, lung, and colon cancer in our demographic population. And they get incorporated in with the general cancer category and looked at as a broader group rather than specifically as a lung cancer subset. But I think, what do I think would be the good quality measures for lung cancer patients? Ideally would be adherence to NCCN guidelines. Are they evaluating the performance status? Is pain management being done appropriately? Which treatments ideally are offering the best chance for overall survival rather than progression-free survival? I think overall survival may be a potentially an easier data point to collect rather than progression-free survival. Those are things that I think would add value in general. I don't think at this point there's a lot of downside risk to providers just yet in terms of cost of care overall. In the near future, when it does happen, providers need to be able to assess their patients, educate their patients before they start them on therapies.